Welcome back, and thank you for staying with us here tonight on NTV Weekend Edition. Tonight we talk about the new COVID-19 variant Omicron, but of course we did see last week South African scientists discovering this new variant of COVID-19, and different countries have since taken different measures to ensure that the importation of the variant is controlled, with some going as far as imposing travel bans. Now the Minister of Health, Dr Jane Ruth Aceng, told journalists this week that to date the country has registered 127,485 confirmed cases of COVID-19. Vaccination for COVID-19 currently stands at 6.9 million doses administered. As we speak, about 38 countries have confirmed the presence of Omicron variant in their countries, of which the US and Australia are the latest. Now, with so much uncertainty about this new variant, vis-a-vis the poor appreciation of the vaccine, we do speak to Marie Nanyanzi, the Senior Program Officer, Sauti Za Wananchi, joining us tonight on Zoom to discuss this matter. A very good evening and welcome. Thank you so much for joining us tonight. Marie, I'm hoping you can see and hear me.
Thank you, Sandra. It's a pleasure to be here.
Well, just diving into...
I can't see you, but I can hear you.
Okay, great. We'll do with that. Just looking at the latest statistics from the Ministry of Health, where we are seeing only 6.9 million Ugandans getting the vaccine, would you say we are doing well according to the global pandemic crisis?
Well, I think we cannot say that we are doing well or we are doing terribly, because we know that from the onset we've had issues with access for the global south, so that is a factor that has to be put into play. But what we see is that among the population, we do have a fairly high number of those that are willing to be vaccinated. So all the different activities that have been going on, the different campaigns, have pushed that number of those that are willing to be vaccinated to 85%. But we cannot ignore the 15% that say they are not willing to get vaccinated. And that, I think, is the challenge. How do we get to the 100%? Because even the countries that have access to the vaccines still struggle to get their population to be 100% vaccinated. So it's still a challenge.
From where you sit, where do you think the missing gap is? I mean, if you're giving us 85% and 15% to those that are not willing to get vaccinated, where is the challenge, and how then do we address that?
Okay, so the challenge we have, I think, is to do with largely, for those that are hesitant, we have a higher proportion of women that are not willing to get vaccinated. Then those in the urban centers are also not as willing as the rural dwellers. So it again implies that there is a need to have more dissemination of the importance of vaccination and its benefits, and also reacting very quickly to all the different misinformations that are, or misinformation or falsehoods about the vaccination. Because if those are dealt with, maybe then we are able to move the 15% closer to it, and then also increasing the number of the vaccination points. Because last year, I think around November, we carried out a survey that was showing us that people say that one of the challenges they face is that they don't have enough centers to go to. But we see a lot has been happening, and probably that is what has pushed the number to the 85% that are actually willing to get vaccinated.
So from where you see it, it's very important for us as a country to increase the vaccination points. Maybe some of the people are not able to access the vaccines. Is that correct?
Yes, some of them are not willing to, are not able to access the points, but also the information that, oh, vaccination is happening in this place. But also using influential figures that people respect and trust, that would move a number of those that have trust issues with the vaccine to go and get vaccinated. So it's twofold: the vaccination points, and then also that dealing with the issue of trust.
Issue of trust, you say?
Yes, trust.
Trusting
because
in the vaccine.
That are not with, yeah, trusting the vaccine to be effective, because those that not willing to
Miss Marie, we seem to be losing you there. We beg that you repeat the point for us again, because we seem to be losing you, your internet connection.
That they mention is lacking trust in the vaccine and wondering whether it will even help, because they get to see what is happening in the northern part of is that year of trust, because their thoughts that they don't trust in the vaccine is that points not being enough is not mentioned as high as the issue of the trust in the vaccine. So there is a need to have more communications on the benefits of the vaccine.
Okay, do you think if we document stories of people that have been vaccinated, let's say for more than a year now, and they feel safe to move around, do you think that can help create trust in the general population for those that haven't gotten vaccinated, those that still do not trust it? How do we address that missing gap?
So I totally do agree with you that that is a good avenue to approach, because we've had in some cases when we are interacting with those that probably reside out of Kampala, and they say that they are watching some of their colleagues and waiting for them to complain about maybe they're having issues with their reproductive systems, or they're going to drop dead. And then when they watch them over 6 months and nothing is happening, then they encourage that, oh, this thing is probably safe. So all that and other means of ensuring that people have trust in that vaccine will push more people to get vaccinated.
Okay, great. Now,
in addition to having...
Great. Now, putting Uganda in the middle of the East African, of course, countries, how are we performing? COVID-19 came and we all had to put in place different standard operating procedures. Would you say as a country we are setting the example for the regional countries to perform better in terms of addressing this COVID-19 pandemic?
Okay, so what we see from the data that we have collected, because we do this work in Kenya, Uganda, and Tanzania, we have seen that when it comes to the SOPs, especially the wearing of the masks, Kenya is doing a lot better than Uganda, because they have the police also doing enforcement of the wearing of the masks, while here, it's more like people are now getting used that this is a personal initiative. So we have seen that there are higher percentage of people self-reporting that they wear masks as a means of preventing themselves or their loved ones from getting COVID-19.
So we are still not doing so well, for those that are watching us, according to her.
Hello?
We're still not doing so well in terms of really respecting the SOPs, wearing the mask, social distancing, and the like. Now, we seem to have lost her, but hopefully she can get back on. And my next question is about the Omicron variant. I know there is scanty information about it. The World Health Organization has not clearly pronounced itself on this matter. But from where, again, you people sit, what are your general thoughts on this variant that comes right after the Delta that took and claimed lots of lives?
Sandra, can you repeat that, please?
Well, again, I just want to pick your thoughts on the Omicron variant. We have seen that the World Health Organization has not, still hasn't availed with us enough information. What we have is scanty, and of course, there's that general perception of is this going to be worse than the Delta variant, or is it just an infectious? It's not as infectious as the other one. What are your thoughts from where you sit? And for those that are watching us today, how do we prepare ourselves for something like this that we are not fully aware of yet?
Okay, Sandra, thank you. I think that the thing that we should really do is to wait for the scientists or the science to tell us what this Omicron is all about. But in the meantime, we continue to get vaccinated and we continue practicing the SOPs, because you definitely don't want to be the first example of what the symptoms of this new variant are. You want to stay safe and ride it out until we get the proper symptoms and also get to know more information about what vaccine really works for this new variant or not.
Okay. Now, from your latest report, this is going to be probably my very final question to you. From the reports and your interaction in the region, are there those other key aspects that you feel our viewers tonight should know before we let you go?
Well, what we see from our report is that when it comes to the vaccine hesitance, in Uganda we have a lower number of those that are hesitant, followed by Kenya and then Tanzania. So I think overall, for all the different activities that have been put in place or campaigns, it has been working and Uganda is progressing well. So we cannot afford to give up. We need to continue to fight this pandemic so that we are able to open up and continue with our lives, because we know that COVID has really heavily affected our livelihoods as a country.
Thank you so much, Madam Marie Nanyanzi, the Senior Program Officer at Sauti Za Wananchi, for joining us on short notice tonight on Zoom. We do appreciate that, and we do hope the report and the latest discoveries can be availed to us on all our social media platforms so that we better understand how we are performing in terms of COVID-19 pandemic, in terms of respecting the SOPs, and of course vaccination. Now that brings us to the end of this conversation, but we once again want to remind you to go get vaccinated. Do as much as possible to get vaccinated. We know that over 19 million doses have been availed for Ugandans to take. So do get yourself vaccinated as soon as possible. Keep you updated on the latest Omicron variant as the events unfold. We'll take a short break and we'll return with NTV Weekend Edition.